Well, in the past, a hip or knee replacement meant a long surgery and recovery, but things are different now. Orthopaedic Associates of Wisconsin performs these procedures in a much less invasive manner. Dr. Stephen Mirko is an orthopedic surgeon, and Chris Ford is his patient. Nice to have you gentlemen here today. I appreciate it. We actually have video we're going to show in a minute of you post-surgery, so I'm looking forward to seeing that. But, you know, knee and hip replacements have been done for decades. I mean, my grandparents had hips replaced and things like that, but things have really changed a lot, haven't they?
They have. But first, I just want to mention it's really nice to follow the hot dish segment. The last time I was here, I followed some sort of a sleep program. So
right.
Great. So
yeah,
thanks
no, but
very
she's
much.
A hot dish and a hard act to follow, I would say.
But yes, there's a lot new out there with joint replacement and lesser invasive procedures. What we're going to talk about today is the Makoplasty, and also to mention this anterior approach hip replacement. But the Makoplasty is it's a partial knee replacement, and it's done with robotic assistance, no muscle cutting, so the recovery is just much more rapid. And as you'll see, I think we have a segment of Chris.
Yeah, and I want to just really quickly show the difference with these models that you brought. So this is what a full knee replacement is like. What is about this that's fully replaced?
Okay, so can I grab this from you for a second? This, think of it as a knee replacement as kind of a crown on a tooth. I mean, it's where the end of the bone is prepared, and then there's like a cap put on. That's the femur or thigh bone portion. And the tibia is more of a base plate is put on top, and then this plastic portion is more like the Teflon. Okay. And so this is a full knee replacement, and some ligaments, or particularly one, need to be sacrificed in this procedure.
And some people have to have a full knee replacement.
Absolutely.
Okay, now
and it's a good procedure, works well.
Okay.
But I think if a person is a good candidate, like Chris was, why replace portions of the knee that are normal?
Right.
And why not preserve as much as you can? So this, let's see, how do we get a good
Just take this off here. There you go.
Thanks. I knew you came here for a reason.
He's a good patient.
Yeah. So this, you can see there is the inner compartment is replaced, and here there's the groove, and the kneecap has a new surface. But I'd say the majority of patients that we do this procedure on just have the one compartment, but we also do two compartments, which would be then the inner and then the kneecap compartment. And all the ligaments are preserved, and there's no muscle cutting, and you'll see.
Yeah, so Chris, what was going on? You just had a lot of pain in your knee?
Yeah, I had gone for a walk on a beach, and frankly, and then I went for a bike ride the next day about 3 or 4 years ago, and it had been building up for some time, but then I couldn't walk. It got all swollen. And I realized I needed to do something, so I did a lot of research on full knee replacement, and found Makoplasty, and it's turned out to be a very good result. Okay,
so we just got a little glimpse of the video. Let's look at it, because from what I understand, it's hard to tell from this is just how much post-surgery, how long after surgery?
I think it was 9 or 10 days.
Okay, and it's almost like you can't tell which knee was replaced.
Yeah, and I would ask the viewers to try to figure that out.
Okay, because I'm looking at it now, and he's going to turn around and walk towards us in this video. That's just 9 days after a partial knee. I can't tell which knee it is.
Yeah, I think it was the left.
Is it your left?
Yeah, it was my left.
How did it feel at this point, Chris? 9 days post-surgery.
It was a little achy, but frankly, it felt about like that looks. It was very functional. I was very happy with how quickly I could walk, and
you're looking good in those shorts there too.
I thought about wearing it today, but no.
And he talks about doing a little research. Boy, he's an attorney, and he came in. He had this researched out, the full.
And he picked you to do it.
Well,
that says something too.
Yeah. Thanks.
Well, how does it feel now, and what are you able to do? Do you work out? Do you exercise regularly?
Yeah, I work out twice a week, and last week I spent all day planting trees, digging holes, and doing stuff. It really, this is the better knee now, the one that was replaced.
Really?
Yeah. So I mean, it's it's as good as better than it should be for a 61-year-old. It's
And
really
you would
good.
recommend it to someone who needs a partial knee replacement?
For somebody who I think is a good candidate, who's active and wants to have an active life going forward, yeah, I hope I think I'm like that. I hope I'm like that, and I think other people would benefit as well.
Our group, I just want to give the proverbial shout out to. We have done now I think it's well over 500 of these procedures. Our group, Orthopaedic Associates of Wisconsin, was the first group to perform this procedure in the state of Wisconsin, and I think it's back to 2009. And so it's not just me who's doing this procedure. There's my partners, several of them that are proctors and help teach this procedure as well.
And I think it's wonderful to be able to get back, like Chris did, to exercising like he did. It's fantastic, and I think it's definitely worth the conversation and checking out. Thanks. If you need, if you've got knee pain or swelling, or the same with hip, because there's a new approach now to hip replacement as well. So you can find Orthopaedic Associates of Wisconsin by calling 262-544-5311. Their website is orthowisconsin.com, and they're located in Waukesha. They're also on Facebook. Nice to have you, gentlemen. Thank you so much.
Thank you.
Thanks again.
Appreciate it.